30s. A Code Blue has been in effect since January 19th. During a Code Blue, the city relaxes shelter intake rules and sends outreach teams into the streets to try and connect people with shelters or safe haven beds. However, at least 18 people have died outside since the city activated that Code Blue. For a different perspective on this, I want to bring in Nathaniel Fields. He is the CEO of the Urban Resource Institute. That is a nonprofit that operates transitional housing for homeless families here in the city. Nathaniel, welcome to News All Day. Thank you for being with us. It's good to have you. And again, we're hearing about how the city is relaxing these intake rules, but what does that actually mean?
Yeah. Well, Shannon, thanks for having me. It's so important to do this story. As you said, URI, Urban Resource Institute. You know, we've been doing this work for about 45 years, and we're the city's largest, if not the nation's largest provider of domestic violence shelter services. And of course, we work with the unhoused each and every night. About 4,000 individuals sleep in one of our domestic violence shelters on any given night in New York City. We try, when we have serious issues like Code Blue, freezing temperatures below 32 degrees, to create a low barrier to access shelter. So the rules means that if a New Yorker is walking down the street and they see someone who seems unhoused, they can simply call 311, and 311 will dispatch the appropriate city service to engage that individuals to seek shelter.
So what does that mean for your resources? Because now you have more people who are in need of help.
Yeah. Any crisis, whether it's the immigrant crisis that we saw not too long ago, or when we have frigid weather, it does create challenges for the city. And it's even more important for organizations like URI to partner and to be able to say, what can we do to increase safety for unhoused individuals?
Mayor Mamdani says 1,400 people have been placed into shelter and safe haven sites during this Code Blue. Have you noticed any holes in terms of the city's response? Anything that we could work on for the next time?
Yeah. There's always things to work on for the next time. You know, in New York City, we have about 87,000 people in the Department of Homeless Services system, and URI, of course, is one of those providers. It's a vast system, and we do a lot of things well. For instance, the largest population in any shelter system, particularly in New York, are children. And yet you don't see any children generally on the streets being unhoused. So, you know, let's just put that front and center. We can't wait till a crisis to start to continue to attack this issue. We need to take this opportunity to continue to learn. Let's all be clear. 18 individuals, even one too many to die from hypothermia and conditions that we saw over the last couple of days. We want to take the opportunity, we want the city to take the opportunity to partner with organizations like URI. We've been doing this work for over 4 decades. We've learned a lot. We want to be able to get ahead of a crisis. We want to do more awareness campaigns. When you look at the last administration, we just didn't tell New Yorkers or those impacted by homelessness or domestic violence that services exist before you reach a crisis.
Well, yesterday there was this oversight hearing on how the city responded to the cold, and as you mentioned, 18 deaths. So there's a lot of questions about involuntary removals, which becomes part of the very tricky situation here. Is if there are the services, how do you get people to actually accept them? Here's some sound from that debate yesterday.
If you have a sound mind, you would know that in those temperatures, you cannot stay warm by wrapping yourself up with newspapers.
If an individual is completely lucid, they are dry, they are wearing enough layers of clothing, and they do not want to come inside, they have the right not to come inside.
And it's such a fragile balance, right? Because Mayor Mamdani says 37 people involuntarily removed during the cold. He wants it to be a last resort. And state law requires signs of mental illness and danger to self or others in order to do that. But when do we see that? What is it? Is it someone wrapped up in newspapers, clearly freezing to death, but still can't say that they need the help?
New Yorkers should err on the side of caution. If they see someone wrapped up in frigid weather or just exposed, call 311. What the city is working to do is to ensure that those people who respond, those first responders or the outreach workers, the many that were deployed, can engage the individual to do that assessment, to really understand what are those barriers preventing them to seek shelter. So New Yorkers, call 311 when you see it, and we want to continue to have outreach workers and first responders trained up to work with people. You know, it's a double-edged sword, right? It's hard to hold someone rights when you think they're a danger to themselves and others. And so that's the balance, and that's why we want to partner with individuals. By the way, that hearing, I just want to say this. We've worked with many commissioners. We're going to miss Molly Park, a true New Yorker who did some amazing things on behalf of communities and organizations, bringing together with our brightest ideas to solve homelessness.
Yeah, so it seems like it's a tough balance.
Yep.
Maybe, hopefully, eventually we will figure it out. Nathaniel Fields, CEO of the Urban Resource Institute, thank you for your time today.
Thank you so much for having me.